So, Laurie,
Yeah.
with all that's been said in the previous question, should I just stop eating all the things that I enjoy?
Well, that's kind of a hard thing to do. You should, if you're eating things that are unhealthy that you enjoy, you should probably cut them back. Make those special treats, or something that maybe you have every day. Maybe slowly cut it back. Twice a week, and then once a week, and just to where it's not part of your daily routine. And swap it for something that's healthy, and kind of make that a habit as well. It's very hard to go cold turkey on things that you really, really love. So you got to make some choices, and like we say, all things in moderation.
Is that the answer, do you suppose? That maybe our national diet has become excessive in one particular kind of foodstuff?
Mm-hmm. It seems like, yeah, processed foods, quick, easy to grab foods. And I even, sometimes I feel like they make a lot of our processed foods to where it's hard to get off of them. It's the cravings are real, and it's hard to get rid of that.
And I think that's a lot of the reason why we have the yo-yo diets, is because we say, no, you can't have that. No, you can't have that. And you so strongly restrict one food or another. And then, well, I'm off my diet now, I'm going to eat a whole cake. I'm off my diet now, I'm back on sodas. And it's one of those things where there are a handful of things that are, of course, toxic to our bodies. But if we have within moderation, what's the portion? Can I fit it into my day? And that's what's going to make it this, like Sean, brought up, lifestyle. What Dr. Chris is saying, what Lori, what Kenny are saying, is that if we make this, I'm okay to have this on a Friday, this amount of portion, because I've done really well this week. And that's something that we hope to instill in someone, that, because as soon as you tell me no, I'm going to do it. Or as soon as I've withheld for so long, that's the first thing I'm going to want. I think in this quarantine, tell you what, I really need to go to the beach. And I haven't thought about going to the beach as much until today, and I need to go yesterday and now. But I tell you, if I log on and listen to the waves a little bit, I'm a little better. And so how do we fit it in, and how do we satisfy ourselves by just enough instead of overindulging with too much in the future?
Yeah, and this is where when we talk about individualizing the nutrition to each individual patient, in most cases, I would say yes, you can probably have that special little dessert on your birthday or over the weekend or whatever. But there are some hidden eating disorders that are not diagnosed, because the majority of those are starvation type of eating disorders. But there are binge eating disorders as well. And this is on the addictive side, and people really are addicted to a certain food, usually sugar or a simple carbohydrate. And in those cases, they probably are better off avoiding that altogether. You almost have to treat it as an addiction, like an alcohol or a abusive substance. And that's where you really are probably better off really avoiding that at all costs. And then when you do have it, you just got to really reset and reestablish an avoidance to that food. Those cases are not very many, but there are certainly some, and that's one of the things that we as practitioners have to identify and counsel in that way.
So would it be true to say that the myriad of diet options that are out there, for somebody that has formed historically through trying all of these different types of diet, and have got to that treat phase, and then over a number of years, that treat phase has become a binge phase. So they'll starve for a session, starve for 3 months, and then binge for a month, and then starve for another 3 months and binge for a month. Of course, there are consequences along with that, which is obviously a sense of self-worth, a sense of being a failure, a sense of low self-esteem because they can't maintain a certain weight level. It could almost be argued that diets, traditional diets, are contributing to that breakdown.
Yeah. The binging that I'm talking about, the most common one, is usually on a daily or almost daily routine.
Yes.
The nighttime binge eating disorder has just been identified and placed into the psychiatric diagnosis book, of the last one that was published, and it's really been existent for a long time. And so I think a lot of us have that tendency on varying degrees. I mean, I'll go through periods where I just gotta have that glass of milk and 2 Oreos before I go to bed. And so that in my life, that's kind of a really low scale nighttime binge eating that I really have to watch. Now, some people have it where the binge is more like a bulimic binge, where they just don't have the vomiting afterwards. I mean, it's really a lot of food. Mm-hmm. And so you can identify this with a really easy question in front of your patients. Is this a daily or an evening or a nightly routine where you're reaching things that help calm you down? It makes you feel better to eat these things. That's where that binge eating disorder comes from, and it's really probably more common than we might think, just because there's varying degrees of it, and the low grade degree is not really recognized as an issue. It's just something that we struggle with, but I think it's as real as someone who binges on a lot of food that really cause a health issue. So behavioral wise, yes, there's things that we can do to help with that, but I think I don't know if it's really a cycle like you're talking about with 3 months on, 3 months off. It's really there all the time. They might be able to manage it better for a little while they're kind of motivated and doing a certain diet, but it's something that they struggle with all the time.